We are immediately invited to have this very intimate relationship with a patient. They are completely trusting us. And to remember to have the respect for them that they need, I feel like that's a big part of my role here in teaching the nurses. We're very fortunate at U of M. I think looking at what we do on a day-to-day basis in Ann Arbor and to remember that that's not here and to sort of get back to the basics so that the patients will be safe and the surgeons can be really effective. Maybe simplifying it down to the half dozen instruments that the otologists really need to do every single case and getting really familiar with that and not worrying about some of the extras.
Suture scissor? Thanks.
The physicians that we were working with on our team, they really afforded a great amount of respect to the role of nurses in inviting me and hopefully others in the future. I mean, what an opportunity.
Here's this B-dub. So we'll take a 15 blade.
When we came the first time, there were several different nurses that were rotating through each case. This time when we came 6 months later, I felt like we were able to require a little bit more and ask a little bit more and maybe be a little bit more emphatic.
Thank you.
The focus needs to be on the patient. What does the patient need? What is happening in the immediate surgical field right now? Everything else that's happening in the room needs to be secondary. And by the time we were done with our last patient, it was really delightful just to see the amount of focus and the kinds of questions people were asking about what would happen with the patient as the surgery was ending and what was going to happen afterwards really showed the curiosity about the process and wanting the patient to have the best outcome possible.